One.
All right, we have 3 more supine shoulder tests for today. We've got the Clunk 1, the Clunk 2, and the Crank test. Clunk 1 and Clunk 2 tests are for Bankart lesions, and then the Crank test is just for a general glenoid labrum tear. So what we're going to do first, patient supine on the bench as seen here. I'm going to take the patient out into 90 degrees of abduction, shoulder, elbow flexed. He's going to grab my armpit, and I'm going to use my hip or the belt buckle and push into his body so that way the head of the humerus is on the glenoid. And then you got to get really close to the joint here, and if you think you're close, you get 2 inches closer. And you're going to take that patient's humeral head and circumduct it all the way through clockwise and counterclockwise. Now, depending on where the patient is indicating pain is where you think your labral tear or lesion is. Remember, this is for Bankarts, so you're looking at that anterior-inferior aspect of the labrum. So after that, we can go into Crank 2. So the patient is in the same position, abducted and externally rotated. I'm going to have his arm resting on my arm as I'm grabbing underneath his humeral head. And then I'm going to apply an anterior force to the shoulder and a posterior force to the elbow, almost like a lever here, like a ratchet. And we're just going to take it all the way through, all the way up top here. Again, looking for pain in that anterior-inferior region, which should be brought here. And then once we get up here to about 160 degrees of abduction, we're going to do the Crank test, and we're going to internally rotate the forearm, looking for pain with this. Again, this motion is fairly limited due to the Fryette laws, but yeah, these are all good tests to help determine whether someone has specific labrum issues or not.